In practice in Portland, Oregon. So I've been out here for, gosh, almost 9 years. Prior to that, lived in Wisconsin. So grew up in Wisconsin, lived there until I was 30 years old, moved out of the Midwest for the first time, came out to Portland, Oregon to pursue my doctorate in naturopathic medicine. Graduated in 2021. I have my own private practice out here, working with folks from both Oregon and Washington. And then I also am our medical educator for EuroMedica. I will only be speaking about ingredients and research and things today, so I will not mention any specific product names, but if you have questions, you can always reach out to our team for that. Now, as Leah mentioned, I have a home full of dogs. I am a self-proclaimed crazy dog lady. I bring it up for a few reasons. Number one, veterinary medicine was my first career in medicine. So I worked as a certified veterinary technician, which some of you may know is somewhat akin to like a nurse for animals. So assisted in, probably thousands of surgeries, emergency type situations, but also new puppy and new kitten appointments and all of the fun in between. So I bring it up. I have four amazing dogs. One of my dogs is up on the mountain today, and the other ones were quite furious that they did not get to go. Yes, even my Chihuahua is a mountain dog. So I do, hopefully, they all are taking their nap and they have forgotten about the fact that they were left behind on an adventure today. So I do apologize if any of them make their presence known. Okay, I saw a hand up for a moment, so I'm just going to see if Leah needs anything here.
No, I'm sorry, I pressed the wrong button.
Oh,
Continue on. My
I've done it.
fault.
No problem. Okay, so self-proclaimed crazy dog lady, and I do also garden. I have my indoor office also has a mini greenhouse in it, so I know those of you in Wisconsin are hopefully getting a taste of spring sometime soon. Okay, so today we are going to be talking all about immune. So, kind of looking at common infections, how they might present, some of the conventional treatment options. We are also going to look at nutrients I really think of from like a foundational perspective, nutrients that our immune system wouldn't be able to operate without. But also tend to be nutrients that most folks are deficient in. We're also then going to explore some botanicals that can really impact bacterial, viral, fungal infections. And then we're going to, at the end, look a little bit at some protocol building with some of those foundational and targeted nutrients. So, first, what I like to do is kind of start big picture looking at the immune system because sometimes I'll ask patients, I'm like, if you had to point to where your immune system is, where would you point? So a lot of times people will point to their digestive system, which makes a lot of sense, right? We know 70% of our immune system is located within our GI tract. I've also had patients go like this, which I'm like, honestly, that's a great answer because your immune system is everywhere. It is, deeply integrated into every single other system of the body. Our immune system is made up of cells, molecules, signaling molecules, cytokines, interleukins, organs, lymph tissues. I mean, we really have all of those things integrated into every other system, even though we talk about the immune system as being separate from, it is more like integrated with every other system in the body. Now, another thing I like to talk to patients about is, we are an ecosystem. We like to think of ourselves as humans, right? But we are a collection of many different types of microorganisms, whether it's bacteria, it's viruses, it's fungi, it's parasites. I mean, all of these things live within us and have evolved with us over, eons. And every breath we take, every bite of food we eat, every time we sink our hands into the soil and garden, we are constantly exposing ourselves to other microorganisms. Now, I travel quite a bit on airplanes, and there's probably no more highly exposed area than being in a confined space, sharing recycled air with hundreds of other passengers for hours on end. But I don't get sick every single time I'm on an airplane, knock on wood. Yes, I do get sick here and there, but this just shows you that our immune system is constantly active. It is constantly patrolling our body, looking for things that don't belong or looking for specific pathogens that might disrupt this incredible ecosystem that lives within us and also on us. And something else I really like to educate patients on is we can influence our immune system's balance, our immune system's strength, our immune system's resilience by the everyday choices that we make. Yes, there are genetic components that may influence how our immune system acts. We may have certain genetic predispositions for autoimmune conditions or other, certain types of immune dysfunction, but we can still influence how those genes are expressed. We can still influence how our immune system behaves by some everyday choices. So we will be looking at some of the lifestyle components of immune function as well. Okay, so kind of very, very condensed uh, look at the immune system is our immune system is constantly patrolling the body. I kind of talk to patients about it being like the guards of a castle. We have this incredible castle that we inhabit, and the immune system is again kind of maneuvering around, floating through tissues, blood, etc., looking for things that don't belong. And its job when it finds something that doesn't belong is to activate. Sometimes that activation means it sends signals to other white blood cells. Sometimes that activation is I'm going to engulf whatever that bacteria is, or I'm going to destroy this cell that has been infected with a virus. So we're constantly on the lookout for bacteria, fungi, viruses, and also abnormal self cells, precancerous or even cancerous cells. Most of us at any given time will have a certain amount of cancer cells floating through our body. The reason that we don't develop cancer from those is because our immune system properly identifies those malfunctioning cells and then rids them from the body. So, this is again kind of a simplistic view of what the immune system does. Are you self? Are you non self? In an ideal world, our immune system ignores self cells. But of course, we know that there are things like autoimmune diseases where the immune system actually attacks our own tissues. So, one of the most common ones out there is Hashimoto's, which is where the immune system attacks the thyroid tissue itself. So the immune system can also identify things that are not self, but not dangerous. Again, we have trillions of probiotics or good friendly bacteria. We wouldn't want our immune system targeting them. We want our immune system to know these are friendly, good, either commensal or beneficial probiotics that coexist with us and actually help us digest food and make short chain fatty acids and all of the incredible things that a good, healthy microbiome does. Now, the immune system can also run into things that are not self and dangerous. This is where we kind of elicit some type of immune response. And then we can also have some type of tissue damage. So, you fall and you get a cut on your skin, your immune system identifies that there has been some type of damage. And in order to help prevent bacteria or pathogens from entering into that wounded tissue, the immune system is there to stop that attack. Okay, so flashback here to maybe some immunology courses that you've done, but we know that there are kind of two main arms to the immune system. There's the innate, which is what we are born with. This is kind of our first responders, first line of defense. They pretty much have the same response no matter what the pathogen is. So these are things like macrophages. Macrophages meaning big eater. So they go and actually engulf bacteria or virus particles or things and then remove them from the body. We also have our neutrophils, which are generally our first line of defense as far as white blood cells go, any type of infection out there, basophils, eosinophils, etc. Then, of course, we have the adaptive immunity. This is more like what we have been exposed to. And when we have been exposed to something, then the next time around, we have a faster, more efficient immune response. So this is when we're developing antibodies. This is when we are developing certain types of T cells. So It's a really, really beautiful system that I am not doing enough justice for because it is so intricate and complex. But that's just kind of the laying some groundwork for, patients or for folks who just want a little extra immune review. Now, this is another thing that I talk to almost everyone about, the three S's. Now, we know that there are so many things that can weaken our immune system. I would say three of the big ones are stress, sugar, sleep. So I'm usually trying to goal set with my patients, and I'm like, which one of these three, can we focus on until we meet again? So we know that when we have high levels of stress, we're releasing hormones like cortisol, norepinephrine, etc., which their job, those fight or flight hormones, those stress hormones, their job is to keep us alive for, the next couple minutes. They're not really concerned about having optimal immune function because, again, they're just trying to make sure we have our heart pumping, blood flowing to our muscles, probably not as concerned about digesting food and things. So their job is to keep us alive in the short term. And that kind of short term payoff is suppressing immune function because our immune system needs a lot of energy to function. And when you're running from a bear, you are shifting that energy away from your immune system and towards these other fight or flight processes. So the longer we are stuck in this chronic stress picture, over time, we see our immune functions start to decrease. This is when people will start catching every little upper respiratory tract infection that's going around. They get sick all the time. It's hard for them to recover. So I'm always talking to people about stress. Number two, sugar. Ugh. I know it is really hard for a lot of people to either limit sugar or avoid sugar because it's in everything. It's in your ketchup, it's in your condiments, it's in, those sugary sweetened beverages that people are drinking throughout the day. There's been studies showing that a single sugar sweetened beverage can reduce immune system function for 4 to 6 hours after consumption. So if someone is drinking multiple sugary beverages a day, they're keeping that immune system kind of in a constant state of suppression. And then last but certainly not least is lack of sleep. A lot of times I like to ask this question, and have people raise their hands, but, how many people out there get consistently 7 to 9 hours of sleep? Most people will not raise their hands. And this is tricky because when we get less than 6 hours of sleep, we're almost 30% more likely to get some type of infection versus people who sleep at least 6 hours or more. My ideal for most people is 7 to 9 hours. That, of course, is highly individualized, but there's a lot of people running around in chronic deprived sleep states. And that also is going to significantly impact immune function. There are certain cells of our immune system that we only produce at night, especially things like the natural killer cells or NK cells. Their whole job is to go and destroy cells that are abnormal or malfunctioning, destroy cells that have been infected by viruses, bacteria, whatever the case. So we only produce those when we are sleeping. Okay, let's look at some of the common infections out there. Today's focus is primarily going to be on viral infections, and we'll kind of get into why that is. But I will also touch on some bacterial fungal things as well. The reason that I tend to focus on viral infections is because these are some of the most common infections out there. The average adult will get 4 or 5 upper respiratory tract infections per year. When I say upper respiratory tract, I'm, anything from the nose, the mouth, all the way down to like the larynx. So that is upper respiratory tract. That also includes ear infections, sinus infections, colds, flus, etc. Another reason why I focus on viral infections is because kids get 8 or 9 of these per year. If you have small children and they are in daycare, they come home with something that feels like probably every couple weeks or every other month. And look, kids get 8 or 9 of these infections a year. So, that's kind of spot on because kids' immune systems are kind of developing. They need to be exposed to a lot of things kind of early in life to fine tune their immune response. So at the end, we'll also look at some protocol building for looking at post-viral syndrome, which, long COVID, chronic fatigue, fibromyalgia, they kind of have a similar symptom picture. Also look at a couple autoimmune conditions and then candida as well. Okay. I don't know if you've seen this commercial, but there is a commercial that I saw. I forget what streaming service I was watching, but they called it Flu Noro Coco, which is basically meaning that we have this widespread kind of viral issue that has to do with influenza viruses, which is where the flu comes from, noro or norovirus, co for COVID-19, and then co for also common cold. So, of course, they're telling you to spray down all of your surfaces with this stuff that I will not mention by name, but basically, spray down your surfaces because it'll kill 99.99% of these viruses. Well, what about the, small percentage of those viruses that it leaves behind? Those are the ones we are actually most concerned with, because those tend to be the most powerful. And again, we are coming into contact with these viruses all the time. So it's not just like, can we destroy all of these viruses out of the environment? I think it's more, can we support the body's terrain or kind of our internal ecosystem to make us more resilient in the face of coming into contact with these viruses in the first place? Now, there is a resource that you can use done by the CDC, the Centers for Disease Control, where you can actually use this hyperlink to check by your state county to look for information on infections in your area that are reported as far as like COVID-19, flu, and RSV, just to kind of see where those trends are. And if things are increasing, it's like, okay, we need to talk to all of our patients about supporting our immune function. So kind of just keeping an eye on some of those trends in your regions can be really supportive. Okay, so I'm going to do a really quick kind of review of that flu norococo, just because people may come into your offices with certain symptoms, and it's going to be kind of a quick review. But basically, what I want to show you is influenza generally has a pretty sudden onset presentation, usually accompanied by a relatively high fever, so somewhere around 102 to 104. I will tell you though, the older we get, the less robust of a fever we will typically mount. So sometimes older folks may not have a high fever, but they still could have influenza because again, the immune system just isn't mounting a very robust response the older we get. Generally, the key things here are going to be body aches and fatigue. Will kind of be self-resolving within about 5 to 7 days. Now, norovirus is what we think of for kind of the GI bug. Also relatively sudden in onset within a couple days and really accompanied by GI symptoms. So a lot of, nausea, a lot of, looser stools or diarrhea, where they can't even really kind of keep water down, sometimes with vomiting. But again, also tends to be pretty quick to resolve on its own within a couple days. And then obviously we know COVID-19 is pretty tricky because it can have a lot of different symptoms. Does tend to be a relatively gradual onset of illness. Uh, that the loss of smell is still probably going to be one of the easiest distinguishing features, but we know that like dry cough is pretty common, fatigue, body aches, possible fever. So again, it can be a little tough, and sometimes these viral illnesses can have overlapping symptoms, and sometimes people can have more than one infection at once. And then last is the common cold. Sore throat is usually your kind of first symptom that people notice. Lots of congestion can kind of linger for about 7 to 10 days. But again, unfortunately, people can have overlapping symptoms, and it's not always super easy to distinguish. So, support for preventing and treating viral infections, I think, is one of the best strategies that we have. Okay, so this is again kind of what I just looked at here, how to tell them apart, looking at clinical pearls. So you can review that if you'd like. And then again at the bottom, multiple viral illnesses happening simultaneously, which can prolong duration of illness, recovery, and also lead to higher rates of complications. So, why do we care so much about viral illnesses? You know, we think about bacterial infections. Yes, we invented antibiotics a long time ago, and that, arguably has saved many lives over the course of, the past 100 plus years. but there's way fewer conventional treatments for viral illnesses. Some of the more common ones we have are for more of the chronic viral diseases, so HIV, human immunodeficiency virus, HCV, hepatitis C. The tricky thing about viral illnesses is you need an antiviral target that is different from the host cell. So this makes things relatively tricky for coming up with viral treatments because again, viruses need to attach to our cells, gain entry into our cells, take over kind of our nucleus, start manufacturing their own viral RNA and proteins or fragments, and then those get released from the cell. So, the viral particles and viral cells kind of integrate with our own. So, finding distinct targets that are different than what presents on our own host cells can make it kind of tricky to come up with some of these viral antivirals. And viruses mutate rapidly, as we have seen with the countless strains of the, COVID virus that's been floating around for years now. And viruses mutate even faster in people who have nutrient deficiencies. This has been proven time and again, especially people with like selenium and zinc deficiencies. Those viruses will mutate faster and can become more pathogenic. Oops. Okay. So this is where I think we need to really reconsider our approach. From a conventional perspective, the primary question is what is the pathogen? Yes, of course, it can be important to identify what that pathogen is, but on the flip side, from, thinking about it through a little bit more of like a naturopathic or an integrative lens, I'm always wondering, why is this person susceptible? We are exposed to all of these things all of the time. So what in this person's kind of history or background or current circumstances is making them susceptible in general? Okay, so then, of course, conventionally, the treatment target is that microbe that they have identified. But again, a lot of infections involve more than one microorganism. And then so naturopathic integrative is, yes, let's look at the how to kind of treat the microbe, but let's look at treating the underlying terrain. Let's, go weed that garden and weed out those pathogens. And then also support a nice, healthy garden ecosystem in the meantime. So, antibiotic usage, first line for bacterial infections on the conventional side, also sometimes recommended for viral infections to prevent a secondary bacterial infection. Antibiotic usage, naturopathic integrative, yes, may still be implemented, but often with caution. And, we are often combining that with gut repair or ways to kind of promote the restoration of that gut microbiome after needing to use tools like antibiotics. So, conventional prevention focus is going to be pathogen avoidance, hygiene, wash hands, etc., possibly even vaccines. But naturopathic integrative, again, is we know we can't avoid pathogens, so let's optimize our immune system year round. Yes, of course, there's like primary immune seasons, but we can get sick at any point throughout the year. And then recovery support really kind of on the conventional side is going to be symptom management and often symptom suppression, especially when people have like colds or fevers. We're often kind of suppressing that symptom, even though it is a normal response of our immune system. So, recovery support on the naturopathic side, we're going to look at nutrition. Maybe that means a short fast for some of these illnesses, looking at how to improve sleep, stress, gut health, etc. Okay, so now we are moving into foundational immune support. So these are some of the key nutrients that we need to just build our castle walls in general. We of course have specialized tools that we'll talk about in the second half of the presentation, but those specialized tools can't really do their job unless we have a solid foundation. We need to build this castle brick by brick, and there are certain nutrients that we need to make those bricks, keep those bricks together. It's really tricky to kind of not have these foundational nutrients and then people think, oh, well, I'll just take XYZ herb when I start to feel sick. And it's like, okay, but we still need certain things every single day for our immune system to function optimally. So there really is no replacement for basic nutrition. We know that having deficiency, even a mild deficiency of single nutrients, can significantly alter immune function. I'm talking here about vitamins, A, C, D, E, B vitamins, etc. I'm also talking here about minerals. There are actually more mineral deficiencies in the United States because minerals are harder to absorb than vitamins. Plus, a lot of our crops are grown in mineral deficient soils, so we're not really uptaking them from foods and things that we eat in the same way that we might have, just a couple decades ago when we weren't, just doing garden or farming practices that were depleting the soil. So we know that almost every single patient or client that you are working with is going to have even a mild deficiency in any one or multiple of these vitamins and minerals. So, some of the ones that I think about a lot are, of course, going to be vitamins A, C, D, and E, and then also zinc and selenium. We know that vitamin A is super important for like our skin barrier, uh, and our barrier, this, and also like our mucosa in our mouth, digestive system, respiratory tract, all of the things that come into contact with with the outside world. We need these vitamins and minerals in order to keep that barrier nice and strong, to prevent dryness, to prevent cracks in that barrier. It's kind of again like the mortar holding those bricks together in our kind of castle. So this really is the first line of defense to stop pathogens from entering in the first place. These vitamins and minerals also stimulate immune cell production. They help with proper immune cell signaling. They enhance our immune cells' ability to both identify and also target pathogens. Protection from oxidative stress. We know that vitamin D deficiencies set people up for autoimmune conditions. There's a lot of research showing that vitamin D is absolutely necessary for proper immune system functioning from both the innate immune system and also on the adaptive side of things. So, as you know, maybe not as exciting as it should be, is I'm always talking to my patients about taking a good multivitamin mineral supplement because I get it. Eating a well balanced diet that is full of nutrient dense whole foods, a variety, we're supposed to eat like 40 different plant foods every week to support a healthy microbiome and get all of these nutrients. Like for a lot of people, it's not happening. And instead of having them feel guilt or shame about it, I'm like, look, let's work on your nutrition and also have you do a multivitamin mineral in the process. Because again, most people are going to have relative deficiencies in these nutrients. And we unfortunately know that nutrition can be really challenging for people to make significant changes in a short period of time. So I'm always looking at something that has like the bioactive forms of the B vitamins, meaning the B vitamins that have already been methylated or in their human form. You've probably heard about like the MTHFR gene variants, methylene tetrahydrofolate reductase. Basically, it's how we can convert B vitamins from foods or other things that are in their more inactive form. It has to go through a conversion process in our liver to become active B vitamins. Those folks with the MTHFR gene variants often have impairments in their ability to convert those inactive B vitamins into the active form. Not only the people with MTHFR, but let's think about how many people out there have liver dysfunction. Type 2 diabetes, non alcoholic fatty liver disease, which is now renamed to MASLD. But anyway, we think about the number of people with MTHFR, the number of people with liver dysfunction. There's a lot of folks out there who aren't able to convert those B vitamins into the active form. Also, looking at our vitamin E as the family of the D alpha and mixed tocopherols, because vitamin E is a family with many family members. So we don't just want to take one of the family members. We want to get kind of the whole crew. And then vitamin D3, which is a preferred form to vitamin D2. And part of the multivitamin mineral is having those chelated minerals. Remember, minerals are hard to absorb. So chelated means they are bound or attached to an amino acid. A lot of times the amino acid glycine is used. So it's a chelate that is magnesium, or let's say magnesium glycinate or zinc bisglycinate chelate. Basically, it means that mineral is attached to one or maybe two amino acids. We know that our stomach lining very easily recognizes amino acids and then will help kind of pull that mineral into our bloodstream as well, like in the intestinal tract. So chelated minerals are easier for most people to absorb. And we know that in addition to a good quality multivitamin mineral, there are folks out there who may still need additional vitamin D. I think it's my next slide. I'm going to skip to it really quick here, but this really kind of irked me. There was a kind of like a editorial that came out in the New England Journal of Medicine saying that we need to curb unnecessary vitamin D testing, which is really unfortunate because vitamin D testing, I think, is super important for most people, especially people living up north in Wisconsin or the Pacific Northwest, where we don't get abundant amounts of sunshine at the right kind of angle from the sun to be able to help create vitamin D throughout the year. So, this article basically said that people are testing vitamin D too frequently, and it's kind of a low value or low yield test. I do not agree with that. I think vitamin D deficiency is quite common. You've probably seen a lot of folks with vitamin D deficiency. Over 40% of Americans are straight up deficient. When we look at deficiency by the numbers, a deficiency is going to be less than 20 nanograms per milliliter. Insufficiency is 20 to 30 nanograms per milliliter. Conventionally, anything over 30 is sufficient. Most integrative or naturopathic practitioners are going to say that a vitamin D level of 60 to 80 is a little bit more ideal, especially for people who are worried about having optimal immune function or trying to, prevent their risk of autoimmune conditions, etc. So, when you are vitamin D deficient, number one, you have an increased risk of infections, that viral and bacterial, and I would also probably add fungal, parasitic, etc. Some of the common symptoms we see: confusion and brain fog. How many people do you talk to who have brain fog? Have they had their vitamin D levels checked? I'm not saying it's a cure all, but it's absolutely a place where we can start. Weak, sore, painful muscles. You all are kind of the experts in people dealing, with pain or muscle soreness or tension and kind of these things that people maybe wouldn't attribute back to, again, vitamin D deficiency, also fatigue and tiredness, bone and joint pain. So I really like to have people get their vitamin D levels tested, ideally twice a year. So in the fall, September and October, because I want to see where you're at kind of after summertime, after ideally you've exposed your body to natural sunlight without getting sunburn, and see kind of what your reservoir is in fall going into winter. Okay, so check in the fall and then also check in the spring. I want to see where you're at coming out of wintertime. How have those vitamin D levels, have they remained consistent or have they dropped pretty significantly? So that can kind of help us figure out what level or what like IUs of vitamin D people may need to take. Okay. Also, there's a lot of folks out there who may need extra zinc and selenium. Like I told you, zinc and selenium are two of the most common mineral deficiencies out there, and they increase your susceptibility to colds, flus, infections versus folks who have sufficient levels. We saw this a lot of research on zinc and selenium actually during the COVID-19 pandemic, where people who were deficient or insufficient in zinc and selenium often had higher mortality rates or higher rates of infection from COVID-19 in general, prolonged recovery, increased need to be on respirators or hospitalizations. So those are two minerals I think that are absolutely essential for the immune system as well. And thousands of studies have shown that people with high blood levels of zinc and selenium could either avoid or reduce the risk of infections and of all kinds. And I did also mention kind of earlier on that when people are deficient in zinc and selenium and they get a viral illness, that virus is going to mutate faster in people deficient in zinc and selenium. So, a lot of times when those viruses mutate, they become more pathogenic or they become, harder for the next person to have to handle, or when they mutate, it prolongs the recovery period, etc. All right, you may be wondering, why is curcumin in your foundational kind of suite of immune products? When we talked about kind of sleep and stress and sugar, a lot of the reason why they are so harmful to the immune system is because they set us up for an increased risk of chronic unresolved inflammation. And this is kind of where curcumin really shines. So I absolutely think that when our immune system is kind of distracted by this chronic unresolved inflammation, we are putting a lot of our energy and resources into that kind of bucket of chronic inflammation, which is pulling resources away from our immune system being able to patrol our body or our immune system from attacking and eliminating viruses and bacteria. And in addition to that, there actually is some research on curcumin for its antibacterial properties, antiviral. Some of the viruses are like influenza, hepatitis C, HIV. And I like it too because it's really great for protecting the liver. We know that liver dysfunction has a lot of overlap with immune system dysfunction, which I'll actually touch on a little further on with angiographis. Also, curcumin improves insulin sensitivity, boosts mental health. I mean, the list of side benefits for curcumin goes on and on and on and on. So I do consider this as somewhat of a foundational nutrient for most people. Again, the more kind of inflamed we are, the more resources we are pulling away from our immune system and its ability to do its job properly, which is protect us and protect this fantastic castle in which we all live. The castles all come in different shapes and sizes, but we all need a certain level of foundational nutrients. Okay, omega 3s. I swear almost every day I look at, various periodicals and, articles and things, and the omega 3s, the more and more research just keeps coming out. One I just read was actually reducing the risk of depression and anxiety for having higher amounts of omega 3s. So, omega 3s are essential fatty acids, meaning we cannot produce them in the body. So, we have to obtain them from diet or we have to obtain them from supplemental sources. So, omega 3 fatty acids also help to regulate our immune function and reduce inflammation. Why are omega 3s important? Because they are incorporated into our cell membranes. Those same cell membranes, not just of like our normal body cells, heart cells, brain cells, etc., but also our immune cells. When we don't have proper levels of omega 3s in the body, in the immune system, this is going to interfere with our immune system's ability for those cells to function properly, to communicate, to send signals. It actually puts the immune cells in more of like a pro-inflammatory state. We also know that increased intake of omega 3s is associated with a lower risk of autoimmune diseases. So there was actually research on a combination of vitamin D and omega 3s for reducing the risk of autoimmune diseases. Like when you have sufficient levels of those nutrients, your immune system is much happier and much more in balance. So I like omega 3s from a salmon source, not in an oil form. I get asked a lot by patients. I take fish oil. Okay, so here's the deal. Oil is a carrier for the omega 3s. The omega 3s, DHA, EPA. Those are the two main ones. So the oil carries the omega 3s. The oil is not the omega 3 itself. So all oils have some level of rancidity, especially, on the fish oil side of things. I've seen fish oil for sale at a gas station. Quick trip for all of my friends out there in Wisconsin. I've seen fish oil on sale at gas stations for like $6.99. I mean, I feel bad because I get people are looking to save money. Supplements are out of pocket expenses. But buying rancid fish oil from a gas station is not doing anything healthy for your body. But people think, oh my gosh, I've read all of this great information about omega 3s. I'm going to buy this fish oil and, put it in my body. Well, again, there's a big spectrum when it comes to quality of omega 3 products. A lot of the low cost fish oils are going to be entirely rancid, may have teeny tiny amounts of omega-3s in general. So I prefer omega-3s from a salmon source that are actually available in like a tablet or a capsule. So not an oil, no risk of rancidity. And it is one of the supplements I think that is ideal during pregnancy and breastfeeding because omega-3s are so important for the developing baby. And then after that baby is born, getting past those omega-3s via breast milk. So one or two tablets or capsules per day. Okay, this is it.
Dr.
Yes,
Locke, may I interrupt you for just a minute?
absolutely.
Are we able to get omega-3s from plant or algae sources?
Great question. So algae is a source of generally more like some of the ALA or like flax and some of the plant oils, chia may have smaller amounts of ALA, alpha linolenic acid, which is a precursor to the omega-3s. Those plant sources generally have very small conversions into actual usable DHA and EPA. I've seen research as little as like 1 to 8% of those plant sources get converted. There are some folks, maybe they're vegan and they prefer to take something that's algae based. I think getting omega-3s in, any way that we can is a great idea. Again, I have had folks switch to the North Atlantic salmon source and done really well, but I also know that there are folks out there with different, lifestyle nutrition preferences. So there are some algae oils out there, but I do think that we have to be careful on some of like the potential contamination and sourcing of those.
Perfect, thank
Okay,
you.
of course. So I'm very excited to talk about this ingredient because as soon as it became available, I added it into my personal immune support protocol. So this is a compound called pleuran from oyster mushrooms. I know mushrooms are a hot category right now, and everyone wants mushrooms for all of the things. But I do not think of this as a mushroom product. I think of it as a compound, yes, from mushrooms, but it acts quite differently. So what I love about this compound is I kind of almost think of it as like a contractor for the immune system. It helps to keep things organized. It helps to, come and make sure that there's not any like leaks or cracks in the foundation. There's not water coming through the walls. It's a really interesting mechanism that I'll get into in like another slide or two. Um, so one of the key things that Pleuran does is it works in the intestines, which we know a lot of our immune system located in that intestinal tract, with these cells or tissues called Peyer's patches. And Peyer's patches, let me see, I think I have it on the next slide. Okay, I'm getting ahead of myself. Pleuran prevent and treat respiratory illnesses, especially those upper respiratory tract infections. So good research on it for reducing the frequency by as much as 50% of respiratory tract infection in kids and adults. But then also helps to shorten the duration of illness when you do get sick with an upper respiratory tract infection. So here is how Pleuran works. We have these kind of like security checkpoints in our intestines called the Peyer's patches. These are groups of different immune cells that they're there because they need to assess what we are taking in from our external environment, the foods we are eating, the beverages we are drinking, etc. All of that is going to come along with these unseen microorganisms, right? Every bite of food we take has little wigglies on it. Sometimes it's great just not to think about that. When I eat something fresh out of my garden and maybe I didn't rinse that piece of arugula before I ate it, I am getting a whole slew of microorganisms. So the Peyer's patches are there to kind of sample what is coming through our digestive tract. When when the Peyer's patches sample or kind of taste the pleuran, it gives a signal to the immune system, hey, we need to be on high alert. There may be something coming through the digestive tract that we might need to address. So pleuran has patterns on its exterior, if you will, that kind of has these patterns that almost trick the immune system into thinking that there could be a virus or a bacteria or something coming in. So it's not stimulating the immune system, but it's more drawing the immune system's attention to say, hey, we better tighten up, we better stop slacking, we better go get out and patrol and see what's going on in the body to make sure that there isn't, some infection that has come along without us knowing. So the Peyer's patches sample that pleuran. It gives a signal to the other immune cells in the Peyer's patch. Some of those immune cells travel to our local lymph nodes and then disperse throughout the body. So it really leads to what I like to call whole body immune surveillance. So again, we are not overly stimulating the immune system. We are telling the immune system that it needs to pay a little closer attention and it kind of needs to, get its act together. So increasing whole body immune surveillance. There's some really great research on a variety of viral infections. One of them was actually in people with herpes simplex virus 1. So we know that the herpes viruses, there's the one and the two, kind of upstairs and downstairs, but they can both cause an infection in either place. So they're not this one was focused more on like oral herpes, but this was a two-phase trial in people who had active herpes symptoms tingling, blisters, weeping from like various lesions. So they received their standard of care plus a placebo or pleuran. So in the acute treatment, they took a higher dose pleuran with vitamin C and zinc for 10 days. So that was phase 1. And then phase 2, they switched to a lower dose of the pleuran, 100 milligrams, which was more of like a daily preventive dose for 120 days. So this was a really nice study that, was over 4 months long. At the end, the patients in the treatment group, when they were taking that acute dosage of the pleuran, had shorter duration of symptoms and a higher percentage reach symptom free by day 5. If anyone has ever had herpes outbreaks or knows someone with herpes outbreaks, they are wanting to do anything to kind of resolve those lesions as quickly as possible. So this is a really great addition to that. And again, they did this in combination with standard of care. Now, when they were looking at that preventive level of the pleuran, because when we have something like our herpes or any type of kind of chronic viral infection, we are at a higher risk of having upper respiratory tract infections in general. So when they took the pleuran for that 120 days, the duration of any respiratory symptom they may have had, so especially like runny nose and cough, was reduced by about half. So not only did it shorten the duration of an acute herpes flare, but it also prevented respiratory tract issues and symptoms when folks took it longer term. Okay, this was an interesting study in athletes because we know that exercise is essential, right? Like we have to do it. We have to move our body. We have to, support that lymphatic system. But when you do like very high intensity exercise, it can actually temporarily suppress the immune system. So this was a study on 50 elite athletes. So triathlon, swimming, running, biking, etc. They took 2 capsules of 100 milligrams of the pleuran or placebo for 3 months. The results after 3 months 50% reduction in the upper respiratory symptoms for the treatment group. Only 3 people became sick in the treatment group versus 21 people became sick in the placebo group. So almost everyone taking placebo came down with at least an upper respiratory tract infection during that 3 month study and 67% increase in those natural killer cells versus no change for the placebo group. So increasing those cells that go and target viral infected cells or precancerous cancerous cells, NK cells are super, super important for our immune system. Okay, so how to use pleuran. The daily or preventive dose is 100 milligrams with vitamin C for kids over the age of 4 and adults. So this is a great product for kind of the whole family to be on because we know that if a kid gets sick, there's a good chance that the adult in that household is going to get sick as well. And then there is an acute product, which is 300 milligrams, so 3 times the amount of pleuran with vitamin C and zinc, designed to be taken as 1 capsule for 5 days because most people are going to feel better within that 5 day course, But I will tell you, I've had some folks who have struggled with like recurrent upper respiratory tract infections over the past couple of years, or when they get sick, they are down and out for like a couple weeks. So I have done two 5-day courses back to back. So 5 days and 5 days. And that there's published research on that dosing strategy as well. So I have had some folks kind of be able to break their cycle of feeling sick, getting better for a couple weeks, and then getting sick again. I actually have a one of my patients is an EMT, so she is exposed to a lot of gunk all the time, and we just incorporated this into her immune protocol, and she has not, knock on wood, had an upper respiratory tract infection since. Now, the key thing about this product is you need to take it on an empty stomach because we want those Pyres patches to sample or taste that Pluran as it's coming through, not, your meal you ate plus Pluran. The more stuff you have floating through the intestinal tract, the less likely it is that those Pyres patches will sample that Pluran when it's coming through the digestive tract.
Dr. Loch, we do have a question.
Perfect.
Would you want to limit Pluran to when you are actively treating an infection?
So there's kind of two strategies. You could absolutely take it daily preventive. So again, kind of giving that signal to the immune system to stay on its toes. So let's say someone takes the daily preventive during prime immune season. So September, October until like March, April. That's absolutely one strategy. There's also research on Pluran for helping to reduce allergy symptoms. So some people choose it to take year round because once we kind of transition out of our prime immune season, then oh my gosh, it's allergy season. So you can absolutely take it year round. Or if you'd rather use it kind of more as needed, you could absolutely take it when you start to have symptoms. For me, like my first clue most of the time is I start to get a little bit of a dry, scratchy throat. If that happens, I am taking that the triple strength Pluran as soon as possible. So the key is for people to know kind of what their signs and symptoms are, and also to start taking it as soon as they notice something. But I honestly take the Pluran daily because we being in contact with people a lot, we have probably a higher exposure. So folks, you're seeing how many people per day. I definitely think that the preventive option is really great as well. Okay.
Perfect.
I think I
Thank you
have just
very much.
of
And
course, a
then,
couple
yeah,
more
and then
small
we're
questions.
getting to the break time. It's totally up to you when you want to
I
just
think I have just like two or three more slides and then we can transition into the break and then go into part two. So
perfect.
one thing is that we absolutely cannot escape in this conversation is the importance of lifestyle. So these are just a few of kind of my common recommendations. I won't necessarily read this line by line. You will have the slides, but again, sleep. 7 to 9 hours per night, consistent schedule. Yes, even on the weekends. I talk to a lot of my patients about that. Dark and cool room, reducing blue light exposure, all of those sleep hygiene techniques. And again, why do we need sleep? Well, it enhances our adaptive immunity, reduces inflammation, helps us produce those natural killer cells. That's also when we produce our growth hormone. It's also when our brain cleans itself. We have this glymphatic or G lymphatic system that was just discovered not that long ago, where our brain kind of goes through this like cleansing process while we sleep. Our brain cells can shrink as much as like 60% when we're sleeping. So, this is when that G lymphatic system is most active, which we know is like our brain's immune system. Exercise. Okay. Regular, moderate activity, 150 minutes a week. Brisk walking is kind of like a moderate activity. Also, doing some type of resistance training at least twice a week. This is super, super important for, again, improving lymphatic circulation, immune surveillance, reducing inflammation. Stress reduction. I talk to a lot of folks about mindfulness, maintaining social connection, doing some type of deep breathing or relaxation techniques, being in nature. Being in nature is one of like the best things for nervous system regulation. So I'm a huge fan of recommending go take a walk in a park or go to your local forest if you can get to one. Fiber and prebiotics. We know that fiber acts as like a food source for our good, happy probiotics. So working up to a higher amount per day for 25 to 30 grams, which, for people can be uncomfortable at first if they're in a pretty fiber deficient diet. But again, really supporting that microbiome and those short chain fatty acids, which we need for fuel sources for our intestinal cells. Mediterranean diet, again, I'm not too I'm not too stringent when it comes to recommending a specific diet for everyone, but I do often recommend a Mediterranean-like diet for most people because there is so much great published research on, optimizing clean and lean proteins, eating a wide variety of fruits and or colorful fruits and vegetables for getting all of those wonderful polyphenols, having high quality fat sources, olive oil, the good stuff, the like extra virgin olive oil. There's a couple brands that I really like, but they should sting the back of your throat because that tells you that there is a high level of those polyphenols. So again, eating more Mediterranean like or getting to that point, I think for most people is a solid strategy. Hydration, oh my gosh. Sometimes I forget that maybe people didn't learn these things growing up, but I had someone tell me, they're like, oh yeah, I'm drinking, about 30 to 40 ounces of water per day. I'm like, okay, that's fine if you weigh 60 to 80 pounds. But most people, need at least 75 ounces or half of their body weight in pounds. So a 150-pound person, 75 ounces, and then may need to add electrolytes if they're doing vigorous, intense exercises, things like that. But we know that staying hydrated is absolutely essential for proper lymphatic circulation, reducing the amount of those inflammatory cytokines that are floating around, helping to support toxin clearance. And then lastly, social connection. You probably have patients that come to you solely for the fact that you may be one of the only people that puts hands on them. Whether you're doing body work, massage, adjustments, etc., you may be some of the only human touch or contact that people have in their lives. And that is huge. People need hugs, people need touch. We are social creatures. So people need some form of connection, whether it's with other people, whether it's with an assortment of pets or nature. Lack of connection is a significant risk factor for early mortality, even more so than smoking. Social isolation is a bigger risk factor for early death than smoking. So social connection, we release all of the good, happy, feel good hormones when we have social connection. That strengthens our immune response, supports our recovery, and most likely it will extend our lifespan. So again, these are some of the things that people can work on every single day. And I usually give my patients like one category to focus on. I'm like, okay, we're focusing on sleep for the next month until we meet again, or we're focusing on exercise. So I think any of these categories that people can work on is very supportive. Okay, I think we will pause here just because I know we're at break time, and then we'll finish this section and then dive into the next section after break.
Perfect. Okay, Ashley, you're on representing EuroMedica. So please stay on. After Ashley is finished with her presentation, then we'll take probably a 5-minute bathroom and coffee break. Okay, Ashley, take it away.
Perfect. Let me just bring up my slide deck here. Perfect. Thanks so much, Leah. Hi, I'm Ashley with EuroMedica. I'm the business development manager here and have been with the company for 15 years. Love this company. We're a dietary supplement company. We focus on quality products, bringing in things that you won't find anywhere else in the United States. And we're headquartered right here in Green Bay, Wisconsin. And we're also employee owned. So we all have a stake in our company and want to make sure that we're delivering the best, highest quality ingredients to both you and your patients. And I wanted to dive into a little bit about our history. And that starts with one man, Terry Lemerond. He is the founder and president of our company. Terry's been in this industry for over 55 years. He's founded some of his founding companies here in the Green Bay area, where enzymatic therapy and phytopharmaca, which have now morphed into Nature's Way and integrative therapeutics. Terry's also researched and developed over 400 different formulations, which still continue to be some of the top selling products on the market today. So super excited that we get to work under Terry and his amazing legacy. And I wanted to take a deep dive into some of the products from EuroMedica that focus on immune support. So we have a bunch, so I just picked a handful to share with you today. The first is our zinc plus selenium. So zinc plus selenium delivers bioavailable forms of these minerals that your body can easily use and absorb for maximum effectiveness. Zinc is an amazing mineral. It supports white blood cell activity for immune function. It works with selenium to support healthy lung capacity and is a required nutrient for the thymus gland, which is a critical organ in the immune system. Selenium also helps support healthy immune activity and bronchial function throughout multiple pathways in the body. Selenium also works throughout the body to reduce risk of oxidative damage and to support a healthy immune response in the body and inflammation response. Some of the key benefits of selenium or zinc plus selenium is it supports immune strength and upper respiratory health. It's healthy inflammation response, and it protects cells from oxidative damage. So it's a great product that has those two amazing ingredients, and the recommendation is just 1 capsule daily. The next formulation I want to talk about is Andrographis EP80 Extra Strength. So Andrographis is a widely known adaptogen that has been used in Ayurvedic medicine since ancient times and is at the forefront of research today. Currently, there's over 800 studies for Andrographis on PubMed. Some of the key health benefits, because it does so many different things, is a healthy inflammation response, liver support, immune function, joint health, daily energy and adaptability, brain function, and mental clarity. This recommendations for this product are 1 capsule daily, and for extra support, you can take 1 capsule twice daily. So just a great overall blend, like I said, for so many different things. The next product I'm going to talk about is Thyme plus oregano. It delivers immune support that doesn't compromise intestinal or liver health, and it doesn't cause any drowsiness or jitters. The ingredient thyme provides support for respiratory function, healthy bacterial balance in the digestive system, and overall immune system wellness. Whereas the oregano delivers targeted support for the digestive tract and helps keep the immune system healthy during times of stress. And we all know in the current world, we're getting stressors from so many different areas, so that's really important. The key health benefits of thyme plus oregano are healthy small intestinal bacteria, upper respiratory and sinus function, daily immune defense, and gastrointestinal health. It is in a very easy to swallow soft gel. And for adults, we recommend 1 soft gel daily for maintenance. And you can take up to 1 soft gel 3 times daily if you need a little extra advanced support. Children 12 years and up are also able to take this product. So great, again, for the whole entire family. The next product I'm going to talk about is another plant oil product called Sinutol Extra Strength. Sinutol Extra Strength features a blend of eucalyptus, myrtle, plus the power of lemon extract for sinus and immune support. It's combined in an entericotic soft gel to help eliminate any repeat or burping or aftertaste, so you don't have that with this product. And again, this one also provides support without the drowsiness or jitteriness that you sometimes get with different immune support products. The 3 active ingredients in here, the first, eucalyptus, has been studied and shown to support healthy, clear, and sinus passages. Myrtle supports a healthy respiratory environment, and the lemon in this product provides additional sinus and immune support. So overall, this concentrated plant formula in Sinutol Extra Strength supports the cilia in the sinuses, which are those tiny little hair-like things that brush back and forth to clear the mucus out of the sinus cavities so that you can have a healthier upper respiratory function and breathe easier. I really like to take this product if I'm going to bed at night and, when you lay on your pillow and you're like, I just want to fall asleep, but feel like I can't, breathe out of my nose because you have so much mucus congestion. This product really helps support that, like I said, by moving the cilia and moving out that mucus faster. The recommendations for Sinutol Extra Strength is 1 enteric-coated soft gel up to 3 times a day. Because it is enteric-coated, we recommend do not chew this product. Then last formulations that I wanted to talk about today are our aminopleuron products. The first I want to talk about is the extra strength. So this is the first time that this clinically studied and validated oyster mushroom pleuron is available in the United States. So super excited. A lot of the studies have come from Europe. There's over 25 years of research and 40 published studies. And the health benefits of the pleuron and an aminopleuron is it supports intensive acute immune function. It promotes natural resistance, supports upper respiratory function, and it has the clinically studied aminoglycan P4H in it. And again, is sourced from oyster mushrooms and also includes vitamin C and zinc in this formulation. This formulation is only designed for adults for acute immune support. It's recommended to take 1 capsule daily for a duration of 5 days. And the most important thing to remember when taking this product is to take it on an empty stomach. I know Dr. Lexi Loch went through some information on how pleurons absorbed and taste it through the pyrus patches in the body. So we just want to make sure we don't have food in our system to interfere with that process. The other product is just our regular strength aminopleuron. I went over all the great things about pleuron and oyster mushrooms, but what makes this formulation different is it's an everyday use formula and it's safe for children 4 years and up. So you can take it daily to promote natural resistance, support upper respiratory function, and again, has all of those same key ingredients for the aminopleuron P4H and has vitamin C in it as well. And I'm excited. I don't know if I should be sharing or not yet, but we are going to be getting this in a chewable formula this June as well. So it'll be really easy for children to take this product or those patients that don't like to swallow pills and tablets. So another delivery option is coming soon. And again, adults can take 1 capsule daily. They can increase to 1 capsule twice daily. Children 4 years and up can take 1 capsule daily, again, on an empty stomach. Wanted just to share that EuroMedica has a great immune support protocol that you are welcome to check out on our website, and talks about all of our amazing formulations that I went over today and some just for daily immune support like our multivitamin. So you'll find all of that information on this protocol. And then we have so many different educational resources for you as practitioners and for you to share with your patients. We have a medical education team here that you can ask any questions to, whether it's ingredient questions, product questions, patient specific. We can set up calls or one-on-one virtual events for you, whatever works easiest. We also have product sell sheets on every single one of our products that gives a little bit of information on what the product does and commonly asked questions. Many practitioners love to share those with their patients. We also have brochures, the protocol sheets like I just shared with you on immune support, and we also have different protocols for things like pain, gastrointestinal health, hormone health, mood balance, you name it. So please check those out on our website, which is EuroMedicaUSA.com. We also have educational videos that we house on our website or on our YouTube page. I have some of them featured here. We have like our mushroom pleuron one, our zinc, aminopleuron. So please do check those out if you have time. And we also do have monthly educational webinars if that's something that you're interested in learning more about our products. Thank you so much for your time and attention today. I'm sure I've seen many of you at the spring convention. We'll also be at the fall convention here in Green Bay. So hope to see you there as well. If you have any questions or if you want to try a sample of any of the products that I talked about today, please feel free to reach out either by email or phone. I've listed both there. And then again, our email is info@EuroMedicaUSA.com. And if you want to sign up for a practitioner account or just to check out our website, visit us at EuroMedicaUSA.com. Thank you so much for your time. And I will go ahead and hand it back over to Leah.
Thanks, Ashley. Leave that slide up so everybody can take a picture of it to get their information and products if they want. And then at this point, It's 12 after. So how about we take a 5-minute break? Let's reconvene at 1:17, and then we'll conclude the presentation for the continuing education piece of our webinar today. So 1:17, we'll be back in touch with you. Ashley, go ahead and leave your contact slide up,
There.
and we'll see you soon. Thank you. Perfect, Ashley. Thank you. I like your picture. You did very well. Smiling away like usual.
That was all you, Leah. I used the picture that you sent.
Is this the recent spring one?
It is.
Hey, well done. Look at you. And you dressed according to your blue and you just blend right in, my dear. Good for you. That's fabulous. Good. Okay. So probably at 1:15, we can close out your presentation. Dr. Loch can bring up that second piece, and then we'll be all ready to go. Ashley, how's that?
Sounds perfect.
Good. Thank you, ma'am. Thank you for the hearts. Thank you for the thumbs up, everyone that's not taking a break. Just a reminder, feel free to type in your questions through the chat. Dr. Shana, thank you for wanting to try all of these products. Love your comment. And we'll have about 3 more minutes, I guess, or so to take a break. Thanks, everyone. All right, in about a couple minutes, we'll start the second half of the presentation. Dr. Loch, feel free to share your screen so we're ready to go. All right, Dr. Loch, you are on for the remaining of the continuing education portion of this webinar. I hope I allowed everyone time enough to take your break, and handing it back to you, Dr. Loch.
All right. So I am going to breeze through the next little set of slides just because I want to get to some of the other ingredients. However, what I want to highlight here is we absolutely know that there is a huge connection between stress and immunity. And chronic stress equal decreased immunity. So I'm just going to kind of run through these. We know that when we release cortisol and the catecholamines from having higher stress levels, that suppresses certain immune cells. It shifts us into more of a what we call Th2 state, which makes us more susceptible to viral infections and worse allergenic responses. Reduces our white blood cell count overall, and accelerates immunosenescence, which is kind of like immune system aging. So it ages our immune system when we are under chronic stress. So those are some of the direct effects, but then also indirect effects. We know that chronic stress encourages lifestyle behaviors that may decrease immune function. So we may have different dietary preferences. Unfortunately, we're not craving vegetables when we are under stress. It is usually other tasty treats. Whatever your kind of stress food of choice may be, it's generally not broccoli or cauliflower or cabbage. Also, we know alcohol and tobacco use are greatly tied back to, chronic stress. We tend to have more of a sedentary lifestyle. We get kind of down. We don't want to, move or perhaps have the energy to take care of ourselves, and then also sleep issues. So I love using adaptogens. Again, this is kind of another like out of the box type of immune support, but it's using adaptogens to help us decrease our sensitivity to stress so we don't have such a high reaction to stressors. And then also increases our ability to resist stress. I tell people taking adaptogens is kind of like being in a nice white bubble or protective bubble, and then things kind of bounce off easier. You're like, if that bubble was too thin, that might get in and affect us. But when we buffer that bubble with things like adaptogen, things are much easier to just kind of, ignore, or it's like, oh, that doesn't even phase me the way that it used to. So ashwagandha has been shown to reduce anxiety, reduce cortisol levels, support hormone balance in people under stress. So this is a great one too because it can be helpful for sleep. We know that sleep, again, tying back to all of those foundational elements, but taking it during the daytime can support energy levels, and taking it in the evening can support more of those wind down processes. It's also generally combined with other adaptogens like rhodiola, which is really great for things like stamina endurance, or red ginseng by itself, which boosts energy and promotes recovery. So there was a study looking at just red ginseng. It was 100 healthy volunteers and looking at their susceptibility to developing things like colds and flu. There was about a 50% reduction in the amount of people that developed a cold or a flu in those taking ginseng versus those who were taking placebo. Plus, the people who did get sick when they were taking ginseng had less severe symptoms and a shorter overall duration. There's also some good research on ginseng for energy, including things like post-infection syndrome. So this was done by a chronic fatigue, fibromyalgia kind of specialist, world-renowned Dr. Jacob Teitelbaum, who looked at folks who were able to take red ginseng as a capsule or chewable for 1 month. Over 60% of folks felt significant benefits, and some of those benefits were like 67% increase in energy, 72% increase in stamina, 46% increase in sleep. When we have energy during the day to get things done that we need to do, that generally helps most people sleep better at night. So interesting study again on people with severe energy depletion. Okay, so now let us transition away from the kind of solid foundation, which of course, healthy lifestyle, daily multivitamin and mineral, plus potentially extra zinc, vitamin D, selenium, etc. Omega-3s, curcumin, pleuran, I think fits into the mix. Now we're going to look at targeted immune support. So what are our tools that we can use when we do come down with some type of issue, we want to shorten its duration, or sometimes people will choose to take these from a preventive perspective as well. So again, these are kind of like specialized tools we can use within our castle and to keep our immune system nice and balanced. Andrographis. This is a really interesting botanical. I actually grow a little bit at my house. It truly lives up to its name as the king of bitters. We know that bitter herbs have historically been used to support digestive processes, but there is some research on bitter herbs for supporting immune function as well. So I kind of think of andrographis from an immune support perspective, liver health, and there is some anti-cancer research on andrographis, which kind of makes sense. Like if our immune system has the tools that it needs to operate, optimally, and we're working on lifestyle and all those foundational pieces, theoretically that will translate to a reduced risk of cancer. So, here are some of the key ways that andrographis helps support the immune system. Number one, it helps to increase our T cell counts, which help our body fight infections and help our immune system build memory. So, again, when we are re-exposed to something, we have a more efficient immune response. Maybe we get a cold and, it takes us 7 days to recover. Maybe a few months later, we're exposed to that same cold virus or a similar one. Maybe it only takes us 2 or 3 days to recover. That's because our immune system remembers, hey, I saw this virus before. Now I know what we need to do in order to kind of fight that infection and recover faster. Number two, andrographis helps to promote production of certain immune signaling molecules called cytokines, which are ways that we can send messages from immune cell to immune cells or other parts of the body, which gives us a faster, stronger immune response. The better we can send those messages, the better communication that our immune system has. It also boosts macrophage activity. Remember, macrophage equals big eaters. They seek out and destroy bacteria, viruses, cells that have been infected with viruses, other pathogens, cells that are precancerous or cancerous. So macrophages are super, super helpful there. And andrographis also helps to prevent viral adhesion. So the attaching to our cells, which they need in order to gain entrance into our cells and then replicate. And andrographis supports our gut linings, immune defenses, which again is another one of our primary barriers for our wonderful castle in which we live. There's some also direct antiviral activities of andrographilide, which I took this from a paper, but as you can see, it's like andrographis and its key compound andrographilide can target viruses from so many different perspectives. Let's start at 12 o'clock here. Reduces protein synthesis in herpes simplex virus and then also the chikungunya virus. So moving right around that clock reduces receptor signaling, promotes proper interferon response, increases certain T cell counts in people with HIV, inhibits HPV, human papillomavirus oncogenic expression. So that is the process through which HPV virus can actually cause cervical cancer. Restores p53 tumor suppressor genes. We know that our cells have tumor promoter genes, tumor suppressor genes. A lot of those unhealthy lifestyle habits promote those tumor promoters. So kind of hits the gas on tumor promoters and forgets about our tumor suppressors. So we can restore function of those key tumor suppressors by things like andrographis. Also inhibits RNA copies, DNA replication, et cetera, and from a wide variety of viruses, from herpes virus to swine flu to HIV to Hep B, Hep C, HPV. I mean, there's definitely more than this, but this was just the schematic from one single research paper on andrographis. So there was a clinical study looking at supplemental andrographis versus placebo for over 200 adults who had at least two or more symptoms of the common cold. So congestion, runny nose, sore throat, etc. They took andrographis or placebo for 5 days. The andrographis group at the end of day 5 had about a halving of their symptom score, so reduced their symptoms by about 50% compared to placebo. Placebo initially got better for like the first 3 days and then kind of plateaued, which is what we tend to see. And sometimes what will happen after that plateau is people will get symptomatic again, or perhaps they will have a gradual reduction in their symptoms over, another 5 to 7 to 10 days. And some of the key symptoms that andrographis was particularly effective for were treating sore throats and runny noses. Now, andrographis was also shown to improve outcomes in COVID-19. 7 human clinical studies supporting its use in number one, reducing severity of symptoms, and number two, improving outcomes. So it was shown to have a favorable response, reduced hospitalizations, prevented progression, promoted recovery, promoted viral clearance. And I think, again, this is one of those that the earlier you can take it, the sooner you start to notice symptoms, the better, but did also have positive outcomes in people who had even some of the more advanced COVID-19 infections. And similarly, these results were kind of paralleled in animal research, where angiographists helped to improve survival, reduce lung damage, and reduce overall tissue damage. Okay, now the cool kind of piece where the immune system and the liver connect, and why I think angiographis is so great, is because our liver during an acute illness undergoes some pretty rapid metabolic changes that shift it to producing an acute phase response. So driving up some of our acute phase reactants, CRP, fibrinogen, some of these like acute inflammatory markers, which in the short term is very helpful for the immune system. But we also need to get that liver kind of back to its 500 plus other jobs that it does once we have kind of addressed that infection. So angiographis is really good at both promoting a proper immune response and then also supporting the cleanup phase. So in phase one, we have an active illness. Angiographis supports innate and adaptive immunity, reduces excessive cytokines, which can be pro-inflammatory, or those messages that we're sending back and forth. When we send too many of them, that sets the body up for more inflammatory responses. Andrographis shortens that symptom duration, inhibits viral replication. Okay, love that. Would be great even if andrographis only did those things, but again, it also helps with phase two, or that recovery response. Restoring normal liver metabolism, especially for things like glucose and lipids. When we are sick, we alter our glucose and lipid metabolism, making us be in a little bit more of like a higher glucose state, shifting some of that lipid metabolism to, prioritize like LDL and triglycerides. And, that can have an unfavorable change to overall cholesterol balance. Recovery, we're also up regulating NRF2, which increases our antioxidants to help protect our liver from any residual oxidative stress and inflammation, increases the amount of glutathione that we are producing, helps to clear those acute phase proteins, and supports normal bile flow and digestion to kind of get our system back online. Okay, so andrographis, take for immune recovery from colds and flus. Again, really supporting that initial infection and the recovery and cleanup response. It's been shown in clinical studies to shorten viral illnesses, protect the liver, restore levels of those detoxification enzymes, so things like AST and ALT, which can be driven up in some of our viral infections. So typically 400 to 800 milligrams a day. If someone were looking to use andrographis more preventively, maybe 400 milligrams, so once a day, or even once every other day, or perhaps just during cold and flu season. But if someone's struggling with an acute upper respiratory illness, I would probably bump that dosage up to 400 milligrams twice a day. You also want to look for those key compounds called andrographolides. So look for something that has a 20% standardization. So in 400 milligrams, you would get 80 milligrams of those andrographolides. Okay, thyme and oregano. These are concentrated plant oils. If anyone gardens, you know that thyme and oregano kind of set up shop wherever they feel. They grow abundantly, which is great. But they have both been used as traditional medicines kind of since antiquity. We know that getting essential oils from thyme and oregano are highly effective against microbial pathogens, especially bacteria. So in this section, we're going to focus a little bit more on the bacteria side of things. So let's look at some of those common bacterial infections. Number one, E. coli. E. coli cause a lot of urinary tract infections, something like 70 to 80% of uncomplicated urinary tract infections, especially in women, are caused by E. coli. And UTIs are the most common bacterial infection worldwide. E. coli can also cause food poisoning or that kind of severe gastroenteritis, can even cause certain types of pneumonia. We also know there are, strep or streptococcus bacteria, things like strep throat, cellulitis, dental caries or cavities, even systemic infections. Salmonella, we think of food poisoning, stomach flu, flu in quotation marks, and then also staph, which we think of primarily as like a lot of those skin infections. So that leads us to our next little conversation about antibiotic resistance. Oh, this is tricky. We know that the more frequently we use antibiotics, the smarter bacteria become and the more resistant they become to those antibiotics. So let's say, again, you kill 99.9% of the bacteria, the harmful bacteria, when you take an antibiotic. Well, you have left that 0.1% that are now that were, too powerful or developed resistance to that antibiotic. So now if someone gets another bacterial infection, it can be stronger. It can be harder to kill. You may require harsher or more or antibiotics that have a less safety profile. So over the next 25 years, it's predicted that there will be 40 million deaths worldwide from antibiotic resistance. One of the biggest uses of antibiotics is actually in agriculture, in, having too many animals in small confined quarters. That leads me to a different discussion. But anyway, we know that overusing antibiotics increases microbial resistance, and those bacteria can share those resistant genes with other bacteria. So they're like, hey, I figured out a way to not die from this antibiotic. I want you and your family of bacteria to have that information too. Also increases hospital-acquired infections, increases dysbiosis, allergies, etc. Okay, so thyme essential oil and oregano both generally have kind of a couple key compounds that are really great for fighting bacteria. These are terpenes called thymol and carvacrol. Thymol is probably one of the most researched components of thyme, especially in things like Thymus vulgaris, which is a species of thyme. It is anti-inflammatory, antimicrobial against both gram-positive and gram-negative bacteria, so has pretty broad spectrum antibacterial effects, and also reduces biofilms. We know that bacteria and some like to kind of coat themselves in this like weird mucousy, slimy stuff that develops biofilms in the sinuses, in the gut, in the urogenital tract, that make them resistant to antibiotics because those antibiotics can't penetrate through those biofilms. So you just keep pumping that person full of more and more antibiotics. Those bacteria become more and more resistant while they're living in their nice, happy home under that biofilm. And again, it just leads to some of these really intense infections. Carvacrol, another terpene that also has antimicrobial effects, anti-inflammatory, increases our antioxidants like glutathione, etc. So here's some interesting research on thyme being antibacterial. So the higher the inhibition zone, the more effective the thyme was. So it inhibited the growth of these bacteria. So it was effective for E. coli, which again, responsible for UTIs, certain GI infections, can even cause septic infections. Klebsiella pneumoniae, which is of course responsible for pneumonia, but also some of the hospital-acquired or nosocomial infections and some UTIs. MRSA, skin infection, hospital-acquired sepsis, and then staph xylosis, which can sometimes, it's like a normal bacteria on our skin that can sometimes get cause an infection on like implanted devices or joint replacements. UTIs also causes a lot of biofilms. So thyme was effective for all of those bacteria. And I think it's really great for, again, those recurrent UTIs. It targets uropathogenic, so pathogenic bacteria within the urinary tract. Um, so in one study on essential oils that included thyme for uropathogenic bacteria, thyme had the best activity against E. coli. Get this, even resistant strains. So bacteria that were already resistant to penicillins and our beta lactams that were resistant to the fluoroquinolones. So it's crazy that these essential oils can help bacterial resistant infections when we know that antibiotics just keep promoting those resistant infections. And it had demonstrated bactericidal, meaning bacteria killing effects, not just bacteriostatic. Bacteriostatic means you stop them from replicating, but bactericidal means you actually kill those bacteria. Okay, thyme has also been studied in combination with antibiotics to make them more effective. So, thyme oil was tested alone and in combination with one of our antibiotics called tetracycline against things like Staph aureus, E. coli, Klebsiella pneumoniae. Thyme alone was effective, and bacterial was higher, or bacterial inhibition was even higher when paired with tetracycline. So, again, maybe the tetracycline is wiping out 80% of bacteria, and then thyme is targeting some of those antibiotic resistant bacteria that are left behind. Okay, now oregano, kind of similar story here, thymol, carvacrol. Oregano oil was also tested against a standard antibiotic. So oregano oil versus an antibiotic against 4 common bacterial strains. The oregano oil outperformed the antibiotic for E. coli, Salmonella, Listeria, but the antibiotic won out just a little bit when looking at Staphylococcus aureus. So again, oregano performed either outperformed or performed at a similar level as the antibiotic itself. And then I just wanted to highlight oregano for what we call these escape pathogens, ESKAPE, which are some of the biggest threats to human health because they have developed multi-drug resistance. Sometimes we call them MDRs, multi-drug resistant. So some of the Enterobacter bacteria, Staph aureus, Klebsiella pneumoniae, Actinobacter baumannii, Pseudomonas whatever. They're really, really harmful bacteria. And oregano essential oil has been shown to disrupt the cell wall and membranes of all of those escape pathogens. I actually found this cool photo it was a scanning electron image of the control and then those that were treated with carvacrol, which you can see in that top right image, those cell membranes are starting to look different than what they did in the control group. And then they looked at it compared to an antibiotic called tobramycin on the bottom left. And then the combination of carvacrol and tobramycin actually had the biggest impact on disrupting those bacterial cell walls. Okay, there was also a study on thyme and oregano for stopping MRSA.
Dr. Locke, Dr.
Yes.
Locke, I'm going to interrupt you right now. The webinar word that I've just launched for our poll will be thyme, THYME. Please, all participants, type the word thyme in the webinar poll. And Dr. Locke, continue on. Thank you so much.
What a great word to use. Okay, so combination of thyme and oregano actually outperformed some of the antibiotics for MRSA. We know that MRSA is methicillin resistant, Staph aureus, which is highly, highly infectious, responsible for a lot of skin infections specifically that can lead to sepsis or septic shock. It is the leading cause of hospital acquired infections, especially dangerous for older adults. Within 1 year of infection, older folks who have MRSA are 4 times more likely to die than people who have not been infected. So we saw some really good kind of results here for both the oregano in yellow and thyme in green as far as inhibiting MRSA, even against some of the big, big players in these infections like vancomycin, which is one of the strongest antibiotics that we kind of have in the toolkit. Okay. And then what I love about these is, well, they destroy the bad bacteria, but what about our good bacteria in the gut? Many studies have shown that thyme and oregano are not toxic to our beneficial gut probiotics. Yay! In fact, combining thyme and oregano with probiotics has even better antibacterial effects. So there was the control group in blue. You can see that that was the highest rates of salmonella. Probiotic cut that to about 50%. Oregano cut it to a little less than 40%. But when you combined a probiotic and oregano, it was less than 10% of those original salmonella from this study. So super, super impressive results. And from what we can tell,
Almost.
there is
Almost
no
another 15
resistance
minutes.
to the essential oils. There were some researchers who tried to find a strain of E. coli that showed resistance to thyme, and they allowed that strain to replicate for multiple generations. But they did not develop resistance to thyme, even as they allowed them to replicate. Similarly, with oregano, they did that with a strain of salmonella that was drug resistant, but there was no change in efficacy and no resistance developed. Okay, what about viral infections? Well, great question. And yes, there is some great research on thyme and oregano for antiviral properties. So, not just antibacterial, also antiviral. There was a study of people with symptomatic COVID infections who were treated with thyme essential oil, and they had reductions in their symptoms of fever, dizziness, cough, muscle pain, headache, fatigue, weakness, etc. And some additional antiviral effects were things like some of the influenza viruses, Coxsackie virus, which causes hand, foot, and mouth, common cold, herpes, etc. So, how to use thyme and oregano. So, I think about this a lot again for women, especially who struggle with recurrent urinary tract infections. We know that UTIs can be very dangerous if left untreated, but I do think that adding in something like thyme and oregano, either from a preventive perspective or when they are undergoing treatment, can be very supportive. So, when people are looking for more of the prevention dosage, it's like 325 milligrams. And then if they need more acute support or have an active infection, I would bump that up to 3 times a day, so 975 milligrams. So again, UTIs, strep throat. You could even open up that soft gel in your mouth and kind of let the thyme and oregano hang out in your mouth. It's pungent, but especially if you're dealing with any type of oral infection, gingivitis, periodontal issues. Think about this a lot too for people struggling with just dysbiosis. So, an imbalance between the pathogenic and good friendly bacteria, which can come after antibiotics or from nutrition choices, lifestyle choices, etc. Also, things like SIBO support, small intestinal bacterial overgrowth. We want to have a lot of our probiotics in our large intestine. That's where they should be, but sometimes they will end up moving up into the small intestine where they can cause a lot of bloating, constipation, diarrhea, abdominal pain, a lot of these kind of symptoms that we think about with SIBO specifically. And then also some research on them for candida and fungal infections. I think about this a lot too for folks who are traveling, especially to areas where the food or water quality might be problematic. Maybe you're going out of the country, maybe you're going backpacking or camping. I think these can be really useful tools. So, again, these are essential oils, but they are designed for internal use. These are not aromatherapy essential oils. I love essential oils in general. I do use aromatherapy. But again, these are designed and analyzed for their constituents and compounds, and they are tested for purity, potency, identity, etc. These are not just, a $2 essential oil that you buy off the shelf. These are designed for internal use. Okay, last section here, also plant oils, which are eucalyptus and myrtle. Let's talk about sinuses, sinus congestion, sinusitis, inflammation of the sinuses. We have these wonderful sinus passages to help us, trap pathogens, to help warm and humidify the air, assuming we are doing nasal breathing when we can. And as Ashley mentioned, those sinus passages have these beautiful cilia, kind of like our internal sea anemones that stick off of our cells that line our sinuses, respiratory passages, GI. Their whole job is to kind of flutter and sweep stuff up and out. But when we have really thick mucus, those cilia, they're like trying to flutter in a pool of pudding. It's really tricky for them to get any movement to sweep that mucus out of the body. Now, a lot of sinus congestion is caused by viral infections that create inflammation in the sinus passages. Some of the ones that are most responsible for that are the rhinoviruses, so the common cold, influenza, the flu, COVID-19. So again, a lot of these acute sinus infections are a consequence of a viral issue. There is also chronic sinusitis, which is more of an inflammatory condition of the sinuses that affects 15% of the population. So they're basically inflammation in the sinus passages. I'm going to kind of breeze through this, but basically it's a table kind of looking at allergies or allergic rhinitis versus viral sinusitis versus chronic sinus issues. But basically, we're kind of focused a little bit more on the viral sinusitis. But again, the eucalyptus and myrtle can really help any of these conditions. So we're looking again at a lot of sinus congestion that is coming after or with some type of upper respiratory tract infection. So eucalyptus oil is antimicrobial. Eucalyptus contains a compound called 1,8-cineol that has been shown to be effective against the influenza viruses, the COVID, SARS-CoV-2, Coxsackie virus, rotavirus, herpes simplex. What's really cool about a lot of these compounds is, again, they're acting in different levels of these viral attacks. So number one, we have our virus, this little particle thing that is trying to attach to our human cell, where it releases fragments, RNA, that go to our nucleus to replicate its own genetic code. New viruses assemble, and then they kind of burst out from our cells. So eucalyptus has been shown to stop every single one of those kind of steps. It prevents viral attachment and penetration, inhibits viral replication, and prevents virus release from host cells. So we aren't just targeting the viruses from one perspective, we're really stopping them at any point in kind of their overall life cycle. Cineol has been shown to reduce rhinosinusitis, so inflammation of the nose and sinus passages. This was a randomized, double-blind, placebo-controlled trial. 152 people with acute rhinosinusitis took 200 milligrams of Cineol 3 times a day or placebo. At baseline, the symptoms between the Cineol and placebo group were equal. At day 4, we already saw about a 50% reduction in symptoms for that Cineol group. Placebo, maybe about a 15% reduction. At day 7, that symptom score was reduced about 80%, whereas the placebo group still had, significant symptoms, probably about 60% remaining symptoms from baseline. So overall, at day 7, there was a greater than a 3-fold reduction in symptoms for the Cineol group versus placebo. And again, some of those symptoms of sinus issues are going to be headache when people bend forward or kind of palpating or touching over those sinus areas, frontal headaches, nasal obstruction, secretions, etc. 1,8-cineol, interestingly enough, also reduced steroid dependence in asthma. Upper respiratory tract inflammation and asthma are linked. So for the folks who took Cineol, 75% of them were able to successfully reduce their oral prednisolone dose, which is a steroid. And the average reduction in their dose of steroid was about 36%. Basically, the researchers set out in the study to see how much Cineol would it take to equal the effect of steroids. So super, super interesting study. It was 200 milligrams 3 times a day of Cineol. And they were tapering the steroids over the course of this study while keeping that Cineol on board to see how many people were able to continue their taper of steroids without having a huge flare of their asthma symptoms. So again, 75% of those taking Cineol were able to reduce their steroid dosage. Okay, myrtle essential oil also has respiratory and sinus applications. In addition to the 1,8-cineol, it also has alpha-pinene, limonene. So what I love about these is they also have anti-biofilm activity. People who get recurrent sinus infections often have an underlying biofilm issue that is inviting these bacteria and viruses to just hang out under this biofilm where they can be protected. So adding in things like eucalyptus and myrtle to both break up those biofilms, have direct antiviral activity, can be super, super helpful. Okay, so take eucalyptus and myrtle for sinus and upper respiratory tract condition or congestion, no matter the cause. 1,8-cineol is definitely one of the key compounds that is antimicrobial. It is mucolytic, so it helps to kind of thin that mucus. So those underlying cilia, the cilia kind of are in contact with that mucus layer. As we thin that mucus, those cilia can kind of start to move again so we can sweep that mucus up and out of the body. Plus, there's also lemon zest oil for some additional sinus and respiratory support. Okay, it is enteric coated, do not chew. You can do 325 milligrams up to 3 times a day. Okay, last little snapshot here is on protocol building. I'm going to probably keep this short so we can have remaining time for any questions. But we talked about daily immune, good multi, omega-3s, curcumin, pluran. What happens if someone has a cough, cold, or flu? So we want to prioritize those antivirals, things like angiographis's, 400 milligrams twice daily. I would also add in the immune support with the 300 milligrams of pluran. And because coughs and colds usually have a lot of congestion, I'm also going to add in like the eucalyptus and myrtle to help break some of that up and keep things moving. Okay, post-viral syndrome, which of course can be like any lingering symptom after a viral infection, not super specific. But we know that there's often a lot of nutrient depletions in post-viral folks. So looking at things like iron status, supplementing with CoQ10, vitamin D, omegas, zinc, and selenium, those can be super supportive for people dealing with post-viral. And then adding in, the red ginseng for recovery, adding in standardized boswellia for lung support. A lot of people have remaining lung inflammation and breathing issues after some of these upper respiratory viral infections like the COVIDs, things like that. And then again, looking at CoQ10 if they're having, cardiovascular concerns and replenishing those depleted nutrients. Okay, what about those buggers, those pathogenic yeast? Let's say someone has a bacterial infection, they go on an antibiotic, then what happens? They get a yeast infection because we have thrown that microbiome so off balance that it has set the stage for candida and pathogenic yeasts, which normally inhabit our digestive tract, but it allows them to flourish because they kind of go unchecked. So we know that some of the symptoms of oral candida overgrowth are oral thrush. So those kind of white patches or plaques on the tongue and the mouth, fatigue, recurrent infections, digestive issues, skin and nail fungal issues. So again, a lot of that ties back to overall antibiotic usage, having some type of dysbiosis, maybe something like a SIBO, stress, high sugar intake, etc. So, probiotics, absolutely. Replenishing that gut microbiome, also working on the diet, limiting sugar, increasing fiber and prebiotics. So yummy, yummy things for those probiotics to eat once they are trying to establish themselves back into our digestive tract. Andrographis also has antifungal properties and inhibits biofilms. It's even been shown to be synergistic with antifungal treatments. And then again, essential oils really able to eliminate all types of pathogens in the gut without harming those good friendly bacteria. So, taking something like a thyme and oregano essential oil could be super helpful. Gosh, we could probably spend a whole lecture just on autoimmune. But again, really thinking here about optimizing those vitamin D levels, so testing them and then repleting vitamin D as needed. Curcumin has some published research in a variety of autoimmune conditions like lupus, Hashimoto's, rheumatoid arthritis, ulcerative colitis, multiple sclerosis. So thinking about curcumin kind of again, as we reduce that chronic inflammatory load in the body, can we help set the stage for that immune system to start kind of rebalancing and shifting away from that autoimmune burden? Andrographis also has some research for rheumatoid arthritis, a long study in multiple sclerosis. I think it was a 1 or 2 year study in folks with MS, inflammatory bowel diseases, similar picture kind of for Boswellia. Okay, I wanted to save a few minutes at the end for questions. So thank you for your time and attention. I know it is a big commitment for a full 2 hour lecture. So I am happy to answer any questions. If you think of things after the fact, you can always reach out to the WCA or our EuroMedica team, and I'd be happy to get into contact with you.
Dr. Loch, outstanding as usual. Thank you so much. We do have one question. Is there one supplement that contains all of these?
Oh goodness, I wish it'd probably be the size of a golf ball. And this is where I think people's intuition sometimes comes into play too. Is I have a couple like favorites. I couldn't tell you why they are my favorite immune support products, but like as soon as the Pleuran came out, I was like, I feel very strongly about this one. And so I do think that maybe, people don't have to take everything, but if it's something that they feel drawn to or something that they feel they can take at least daily, then like that is a good medicine for them to try. I wish, we had something that combined everything, but I think from a price point perspective and also a size perspective, we would be severely limiting the amount of people that could take something like that. So we do try to have multiple options because people have different preferences, right? And we try to have an immune support supplement for them.
Perfect. Perfect. So you can get off to your patients. Type them in right now. This is your chance to ask live to Dr. Loch. Do I
And again,
see it?
remember, reach out to Ashley to try one of these for yourself.
That's true. That is true. Hopefully everybody took a picture of that slide so Ashley can answer your questions. There she is, Miss Ashley. All right. I have 2 minutes to go. Any other additional questions? Oops. Are there any significant side effects from taking any of these together?
So I think that's a great question because of course we always need to think of, things from a safety perspective.
Mhm.
Do I think that everyone needs to take these all together? Not necessarily, but again, kind of circling back to some of like the protocol slides. When we are looking at something like a upper respiratory tract infection, I feel very comfortable adding in andrographis or another type of antiviral along with the Pleuran, along with something for congestion. Again, I think generally these are going to be a little bit shorter term. So maybe people are doing this for like 5 to 10 days. And with the goal being that we're trying to shorten the symptom duration and then maybe switch to a preventive level of these nutrients for a period of time after that upper respiratory tract infection has subsided. So, I definitely think that taking a combination of these for a short period of time is generally the strategy. Clearly, I'm not in sales where I'm like, you should take all the things all the time. But I think like let's address the acute issue and then move into more of like a prevention strategy after that.
Perfect. Thank you. And I think actually, if I don't see any other questions, we should possibly conclude this webinar. Dr. Loch's information is here on the slide. Uh, oh, thank you for that explanation. Dr. Loch, Ashley, how can we ever repay you? Thank you for educating our DCs throughout Wisconsin and our surrounding states. We so appreciate you. We'll see you at Fall Convention and during our fall webinar, correct?
Yes.
Excellent. All right, participants, I am going to conclude the webinar, which then should pop up a survey. Please complete the survey. This will be part of your CE awarding process. All right. Enjoy your day, everyone. Thank you so much for attending. Bye-bye.